Okay, so hi, good afternoon, everyone. My name is Natalie Ingham, and I am on the HR Benefits and Wellness team. Today, we will be going over the biometric screening process. Feel free to ask questions in the chat or come on mic. So all active employees on the county's medical plan are eligible to earn a preferred premium and save $500 by completing the biometric screening and health survey. So that's two separate things. And the premiums that are currently listed in our benefits handbook and online are the preferred premium amounts. So if you do not do both the biometric screening and health survey this year, you will be charged an additional $500 in premium next year. There are some exemptions. If you are a new employee whose health benefits began July 1st or later this year, then you do not need to do the biometric screening and health assessment. You will need to do it next year, though. Employees who opt out of our medical plan do not have to do it either, as well as spouses, domestic partners, and retirees. So if you are going to be retiring at the end of this year, you don't need to do it for next year. However, if you are retiring at the beginning of next year, I do recommend that you do the the biometric screening and health assessment just to be safe. So what is the biometric screening? It is blood work that is done to measure 7 items, and that would be blood pressure, height, weight, total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. You can also test for hemoglobin A1C, but it is not required. So if you do lab work and one of these items is missing, then unfortunately it will not count for the biometric screening. So make sure that when you go, they are testing for all 7 of these. The biometric screening is considered preventative care, so there will be no cost to you. It'll just go through your insurance as preventative. However, if you are going because you have a lab order from your doctor and they're doing a diagnostic screening, so for example, if your doctor wants to test for diabetes, then this lab work is not going to be considered a biometric screening. It's going to be considered diagnostic screening. So keep that in mind if you do get a lab order from your doctor and you want to go that route. So why do we suggest that everyone gets a biometric screening and does the health assessment? Well, it's because awareness is the first step in maintaining and monitoring your health. Wellness screenings provide the opportunity to get a quick and easy snapshot of your health and detect critical changes or health risks. So without a biometric screening, you may not know if you have high blood pressure or high cholesterol, for example. And then, of course, you want to get a biometric screening if you wish to avoid that $500 in premium next year. We did move up the date, so biometric screenings are no longer due by December 31st of each year. It is now December 20th, and this allows us to just complete any year-end processing and just make sure that there's no last-minute hiccups. So new date is December 20th to do both the biometric screening and the health assessment. Why did we do Quest, or why did we choose Quest? Through Quest, they have their own biometric screening program. There is a very specific Quest portal that you have to go through, and it's dedicated just to Pinellas County employees. So you can't just go to quest.com and make an appointment. You'll have to go to our specific link, and I will share that with you in just a moment. If you use the Quest Patient Service Center, it is very quick and easy. It's paperless, so it's going to cut down on the process and any confusion. However, you do need to use a physician results form if you choose to go to another lab or you go to a convenience care clinic. In Quest, because they manage the program, everything is confidential. They manage the program. We don't get any of your results. All we know is that you have, in fact, completed your biometric screening. So in summary, Quest allows us to manage this program confidentially, and we let them manage it and not in Pinellas County, so you don't have to worry about any privacy issues. Do you have to use Quest? No, you don't have to. You can use LabCorp, Baycare. However, if you use Quest, it's going to be the easiest, most convenient solution or option. Of course, you are welcome to go elsewhere. You would just need to do the physician results form. So that's going to be a couple extra steps, and I'm going to explain that. So there are two options. One, you can do the Direct to Quest Patient Service Center, or you can go the physician results route. Direct to Quest is going to be, again, the most convenient. There's no paper involved. You just go to our specific Quest website, you make an appointment, and go, and that's all you have to do. Your results will be uploaded to Quest automatically. With the physician results form, you're going to have to go get your lab work done, take this form to your doctor to have them fill out and sign off on, and then you will need to fax the results back to Quest or upload it back into the portal. So a few extra steps if you choose to go that route. So before you begin, this is the website you need to go to. So make sure you jot this down. It's my.questforhealth.com. Again, you cannot just go to Google and search Quest. You need to go to this specific website. And if you don't go this way, if you just go through Quest, then there will be no link between Quest and Pinellas County if you just go to quest.com. You need to go through this specific website that is dedicated for Pinellas County with our registration key, which I'll give to you in a moment. Like I said, if you go with option one, you'll just make an appointment through My Quest for Health, and you'll make an appointment. However, if your doctor is ordering your lab work and you still want to go to Quest, do not use this appointment scheduler because that will just confuse everyone. You'll need to do the physician results form, which we'll go over. So this is only if you're going to go through Quest, you're going to make your appointment, you don't have any other lab orders. So you'll make your appointment, you just show up at Quest, but don't go without an appointment, and then your results will be available within 2 to 3 days. It's a very quick turnaround time. And then it takes about 3 weeks to show up on mycigna.com. As always, if you go this route, your personal health information is always confidential. There is a slight delay in getting completions transferred to MyCigna, so just give it a few weeks before checking mycigna.com to check that your biometric screening has been completed. And you will also be emailed your results from Quest once they have received your results. So this is the registration key when you go to my.questforhealth.com. In the green, you're going to have to create an account. Even if you already have an account with Quest, you're going to need to make a new one using this registration key, Pinellas County 22. Note that the P and the C are capital. I'm not really sure if that matters, but I tell everybody to put in the P and the C as capital. You're going to use this registration key. You're going to accept the terms and conditions, put in all of your personal information. For the email address, I recommend that you use your personal email since it's going to send you appointment reminders. And then when you get when your results are ready, they're going to email you that as well. So you don't want to use your work email address since our work email addresses are subject to public record. You don't want your health information out there for the public to grab. Then once you're in there, there is going to be a short questionnaire that you have to take. You can't get past that and make your appointment without taking this questionnaire, but it's really short and simple. Please note that this is separate from the health assessment that you have to take in mycigna.com. This is a Quest-specific questionnaire. It's really short, just a couple questions. And again, confidential. We don't get any of this information. Once you're in there, you will see the option to schedule a biometric screening. So you'll just click on that option, make your appointment. You can select a Quest diagnostic location close to you or close to work, whatever your preference is, and your appointment time. If you do want to get tested for that hemoglobin A1C, you can check that box as well. Again, that's optional. You don't have to do it. And then you'll just hit next and hit confirm to schedule your lab work and appointment. So this process is paperless. It'll bring up a form that you can print if you want to take with you, but it's not necessary. Also keep in mind when you make your appointment that immediate appointments may not be available, so you might have to schedule a few days or weeks out, which is why it's very important to plan ahead. Do not wait until the last minute. We highly recommend that you complete this before open enrollment in November. Don't wait until December 18th to go and make your appointment. Also, really important, this is not just an appointment, this is your lab order, so do not use the scheduler to make an appointment if your doctor is ordering your lab work. This will result in duplicate lab orders and potential processing errors. Now, if you did choose option 1 and you change your mind and you want to do option 2, which is downloading the physician results form, you'll need to log into this my.questforhealth.com and cancel your scheduled appointment. And then it will give you the option to make a new appointment or download that physician results form. So vice versa, if you did choose the physician's results form, option 2, and you want to switch to option 1, you'll just need to hit cancel on the option you chose to be able to switch to the other one. So option 2 is the physician results form. After you log in and you go through that whole process with the registration key, putting in all your personal information, doing that short questionnaire, you'll see the option to download the physician results form. You'll select that order form button, and then you can download it, you can print it, or you can save it as a PDF and email it to yourself, whichever is most convenient. If you are using a doctor, just make sure that the lab work is done at an in-network lab, and make sure that the order form that your doctor gives to you has all those 7 items that are required for a biometric screening. Then once you go and do your lab work, once the results are available to you, you'll want to make an appointment to meet with your doctor again to complete that form. They need to sign off on it. You need to sign off on it, and then you'll need to submit it. If you're going to a CVS or a Walgreens, then that clinic staff will be able to fill out the form for you right there and then, and either fax it for you or just give it back and you can fax it into Quest. So for the form completion, again, just make sure all fields are filled out and both your signature and your doctor's signature is on it. If any item is missing, like one of those 7 boxes, or a signature is missing, then Quest will reject the form and you'll need to resubmit it. So you can fax it. When you download that physician results form, the fax number will be on the form, or you can log back into the Quest portal and upload it from there. Oh, this is the fax number if you need it, and it's also listed on the form. And then you'll see there, if you do log in, you'll get that upload form. And you can upload it as a PDF or a photo type file like a JPEG or a PNG. I recommend doing the PDF route if you want, or, if you can. Otherwise, you can just take a picture like from your cell phone of the form and upload it. So when you do the physician's results form, it's also going to ask you to input your results. So even though you're uploading it, they want to just make sure that the form is legible and that they don't misinterpret any of the numbers. So just make sure that you write clearly, that you put in all your results in their little questionnaire box and then hit submit. So when do you get your biometric results? If you do option 1, it'll take about 2 to 3 business days to get your results, and you should get it via email and also mail. Email you'll get right away. Mail it'll take about 2 to 3 weeks. For the physician results form, you will get an email that your results are available at myquestforhealth.com 1 week after your form is received. Again, Pinellas County does not receive any information. Both your lab results and health survey answers are confidential. All we receive is a report with activity completions and aggregate responses, but no personal data. In mysigna.com, like I mentioned earlier, there is a slight delay between your quest completion and then that getting uploaded to mysigna.com. It takes about 3 weeks after your appointment or after you submit your physician results form for it to show up in mysigna.com under your wellness activities. Your information is going to appear in 2 areas. When you go to do your health assessment, all your results will be auto-populated into that. And it will also show under completed incentives with a green check mark and the date that you completed it. So that's going to be how you know how you have completed your biometric screening. So after you do your biometric screening, you also need to do the health assessment. You can log into mysigna.com, select My Health Assessment from the Wellness drop-down menu, and you'll just follow the steps and complete the health assessment. We do recommend that you do this after you do your biometric screening. That way your results are in the health assessment. However, if you just want to knock it out and not worry about having to do that later on, you can go in today and just do that health assessment. And then if you want it to be really accurate, after you get your biometric screening back into the health assessment and plug in your current numbers. If you need help after today, we do have step-by-step help guides on our website. Just go to pinellascounty.org/HR/biometric, and we have a guide specific to option 1 if you're going to go the direct to quest route, or option 2 to do the physician results form. And we also have a help guide to help you check your completion and just make sure that everything's done and you're not going to be charged that extra $500 in premium next year. And as a reminder, the new completion date is December 20th. The new due date is December 20th of this year. And if you have any questions after today, please reach out to us on the wellness team. That's our phone number or our email address if you have any questions. So that's it. I know I went a little fast. Does anyone have any questions? Feel free to throw them out in the chat or comment Mike right now. All right. Well, if you guys don't have any questions, then you are free to go. Thanks so much for joining me today.